Welcome to the WeRPN Online Learning Indigenous Health Equity. Module 1, Health Disparities and Historical Context, developed by WeRPN with the support of the Government of Ontario. In the development of these modules, WeRPN consulted with an Indigenous health subject matter expert who specializes as an Indigenous patient navigator. In addition, the modules were reviewed by an Indigenous elder. We thank them for their time and their contributions. The learning objectives for this module are that learners understand the health disparities experienced by Indigenous communities, can identify barriers to access that Indigenous people face in Canada, and understand the historical context of colonialism's lasting impacts, the influence and lasting impact that the Indian residential school system and forced assimilation have on Indigenous peoples, and how the resulting environmental and socio-economic impact put Indigenous people at a disadvantage and higher risk. First Nations, Inuit, and Métis experience poorer health outcomes than the general population. Public Health Agency of Canada, 2018. Many factors contribute to these health disparities, including the impacts of colonialism, limited healthy food choices often experienced by First Nations, Inuit, and Métis living in urban, rural, and remote areas, inadequate and frequently overcrowded housing and living conditions, with many Indigenous people living in houses in disrepair and insufficient health services, including lack of services, understaffing, and barriers to access. There are three primary barriers that make accessing healthcare difficult for many Indigenous people: availability, accessibility, and acceptability. As referenced in the fact sheet titled Access to Health Services as a Social Determinant of First Nations, Inuit, and Métis Health, developed by the National Collaborating Centre for Indigenous Health, accessibility of health services refers to services being reasonably obtainable with an adequate number of appointments and hours that enable people to obtain health care when it's required. Availability of services for Indigenous people are insufficient and not equitable compared to the health services provided to the rest of Canada. A lack of health human resources and services has led to longer wait times for Indigenous people with potential delays in diagnosis and treatment. Often healthcare providers from other communities must be brought into underserved communities to provide care, or Indigenous people must travel long distances to obtain healthcare outside of their communities. Sufficient availability is achieved when there is an adequate supply of competent healthcare workers with a diverse mix of complementary skills available to provide care where it's needed. The lack of health human resources mentioned previously affects both accessibility and availability. Factors such as lack of programs and funding, in addition to the complexities regarding jurisdiction and financial resource management, have resulted in unmet needs and even higher mortality rates in Indigenous populations. Acceptability of health services is the willingness of people to access health services. When services are perceived as being biased, and it's anticipated that their needs will not be met, Indigenous people may be hesitant to seek the services they require. The power imbalance that often exists between care providers and patients may also contribute to a lack of comfort accessing health services. Colonialism, racism, and forced assimilation have deeply affected Indigenous communities through practices like residential schools, the 60 Scoops, and the crisis of missing and murdered Indigenous women. Policies aim to erase Indigenous cultures, causing intergenerational trauma, health disparities, and social disruption. Indigenous peoples were also displaced from their land, leading to environmental degradation and loss of traditional practices. Today, Indigenous communities face ongoing poverty, inadequate healthcare, and higher rates of violence, which will be discussed in this section. The content of this section may be distressing for those impacted by the effects of colonialism and the residential school system. For support or crisis intervention, the Hope for Wellness helpline is available 24 hours a day, 7 days a week for all Indigenous people across Canada to access immediate support and crisis intervention. The phone number for the Hope for Wellness hotline is 1 855 242 3310. Colonization is the action or process of settling and establishing control over Indigenous people. Oxford Languages, no date, para 1. When European settlers came to the lands that are now called Canada, at first there was cooperation between the settlers, often referred to as colonizers, and the Indigenous people of the land. Matheson et al., 2022. They shared their knowledge and skills with each other, engaged in trade, and even had military alliances. Soon after, however, as the settlers' population increased, wealth amassed, and the desire for land increased, colonizers began to view Indigenous people as a hindrance in achieving their objectives. They began to systematically attempt to control, and in many cases eradicate Indigenous people using weapons such as guns to biological weapons such as the introduction of smallpox, tuberculosis, and influenza. In the early 16th century, prior to colonization, the population of Indigenous people living on the lands known as Canada generally ranged from 350,000 to 500,000, with some estimates as high as 2 million. By 1867, by the hands of colonizers, the Indigenous population had been disseminated to just 125,000 people. Prior to colonization, Indigenous people relied on holistic systems of healing and practices ingrained deeply in their culture. Burnett, 2023. Although they adapted at first, as Indigenous communities became oppressed and reliant on colonizers, their social, economic, and political systems were influenced, and an effort began for the colonizers to eliminate their cultural identity and traditions, which had been passed down using stories, typically not recorded in writing. Matheson et al., 2022, Burnett, 2023. The treaty that was signed amounts to stolen land, was originally looked at by Indigenous people as a peaceful agreement, and the colonizers viewed it as a way of owning the land. Residential schools were first established in the 1820s, created by the Canadian government and Christian Church to educate, assimilate, and convert Indigenous youth to Christianity. Miller et al., 2024. Residential schools operated for over 100 years, with an estimated 150,000 children attending. The last school was closed in 1996. Often quoted in relation to the horrific legacy of these schools is Sir John A. Macdonald, Canada's first Prime Minister, who said that one of the primary objectives of the residential schools was to take the Indian out of the child. La Forme, no date. Residential schools were often overcrowded and children faced malnourishment, leaving them more susceptible to diseases such as tuberculosis and influenza. Miller et al., 2024. Abuse was common in residential schools. Children were often forced to pray in a style consistent with the school's denomination, received forced haircuts, including having their heads shaved. Toxic chemicals were used to clean their hair and their skin. Food was not usually very nutritious. They were served spoiled food, experienced malnourishment, and children were segregated based on gender, often away from their siblings. The Union of Ontario Indians, 2013. Some of the children even faced more extreme forms of abuse, for example, sexual assault, forced abortion, electric shock, exposure to extreme temperatures such as extreme heat or cold without adequate clothing, and forced to labor, to name a few examples. The Indigenous people in Canada have a spiritual connection to the land, and they highly respect and express gratitude for its ability to meet their needs. Indigenous Corporate Training, Inc., 2015. Historically, Indigenous people have not seen the land as something to be owned, but rather as something that they are stewards of. They feel a responsibility to care for the land and its resources. Indigenous people are especially susceptible to the effects of climate change, due to the many physical, emotional, and spiritual needs being met by the land and its resources. National Collaborating Center for Indigenous Health 2022. Whether First Nations, Inuit, or Métis, Indigenous people often live in remote areas that are more drastically affected by climate change. Climate change poses risks to Indigenous people and communities due to natural hazards, impacts on their mental health and well being, air quality, food safety and security, infectious disease, and their health systems. The creation of reserves led to one of the most racialized environmental disasters in history. Indigenous people were forcibly relocated from their traditional lands and confined to small, often resource poor areas. Historically, Indigenous people viewed land not as property to be owned, but as something they were stewards of, deeply connected to its spiritual and physical resources. This deep relationship with the land was disrupted when the reserves were established, causing significant environmental degradation, the loss of traditional practices, and an erosion of their way of life. The impacts of this forcible displacement continue to affect Indigenous communities today, contributing to poverty, health disparities, and heightened vulnerability to climate change. When European settlers first arrived to the lands now known as Canada, the economies of Indigenous communities began to change as they interacted and traded with settlers. Travado et al. 2022. Over time, as these economies, such as the fur trade, further developed, traditional Indigenous economies focusing on the needs of the entire community and each individual within it suffered long lasting consequences. As resources dwindled, reliance on settlers increased, leading to marginalization of Indigenous people as labor markets developed and evolved. Today, Indigenous economies are complex due to the lasting impacts of colonialism, government policy, and legislation. Poverty affects Indigenous people disproportionately, and they also experience fewer economic opportunities when compared to non Indigenous Canadians. National Collaborating Center for Indigenous Health 2020. Poverty also disproportionately impacts Indigenous women and children, putting them at even greater risk. These disadvantages have a negative impact on the health and overall well being of Indigenous people.